This is an MM+M Fast Break. I am MM+M Managing Editor Jack O'Brien. Please be joined today by a couple of wonderful guests, one who is more than familiar to our audience, Jon Nelson.
Thanks again for having us, man. Jon Nelson. I am the Chief Lived Experience Officer with a brand new company that we're founding called NeuroLivd.
Excellent. And Rachel, you want to hop in?
Yeah, Rachel Wurzman, and I am the CEO of NeuroLivd. And maybe just a little bit about me and about how we got here. So I have always been fascinated by science, really, but my path to neuroscience was really deeply personal, which was originally trying to understand the science behind my own experience with Tourette syndrome and the conditions that come with it. And that curiosity drove me to become a neuroscientist, really pursuing systems neuroscience research and neuroimaging and neuromodulation through my postdoc. But what's been unique about my journey is that I've been able to really supercharge my work by bringing my lived experience directly into the scientific process. So just to give you an example, and I think this kind of illustrates the kinds of things we can do with NeuroLivd. Really early in my career, I networked my way into a research section at NINDS by volunteering as a patient in their studies. But once I joined the lab, I realized that they weren't measuring what they thought they were measuring based on my actual experience in that scanner. So I changed how they were doing their data analysis, and we ended up with the first publication of a neural signature of the sensory component of tics and Tourette syndrome, which is emerging as a dominant understanding of what's really going on. And so it's really been that intersection of lived experience and technical expertise that's shaped pretty much everything that I've done since, which includes becoming a licensed psychotherapist, where my personal understanding of neuropsychiatric conditions brings a depth into how I work with my clients, and also other hats that I've worn over the years. So I served briefly with the Office of Science and Technology Policy in the Obama administration. I've worked in defense and national security. I founded a social health nonprofit that was focused on improving the efficacy of mental health treatment systems. I served as a funder at a philanthropy focused on neuroscience and society, where I funded cross-sector collaborations that embed community perspectives into research and policy and technology development. And more recently, I've been consulting on facilitating and improving that integration of lived experience expertise into neurotechnology. And so Jon and I have, I've got the combination of deep scientific training, clinical practice, and we have the personal experience that really allow us to see opportunities and solutions that others might miss. And that is exactly what we're bringing to our clients.
So, Rachel, I really appreciate you going through, your considerable experience, especially on the scientific side. Obviously, Jon and I go back years at this point, and I'm sure that for those in our audience who listened to our episode in May, they are familiar with your background, Jon. But for those who may not have caught the episode or may not be as familiar with you, talk a little bit about your background and how it ultimately leads into what we're seeing here with NeuroLivd.
Yeah, well, first off, I want to thank MM+M. You guys started my advocacy journey in December of 2021. I spent the majority of my career within healthcare communications, both on the advertising and publishing side. I also spent 10 years of that battling with serious mental illness with very, very severe treatment-resistant depression. My life was saved on August 22nd of 2022, and I've been in remission actually for now 3 years. It's been an incredible journey to be able to come through on the other side and live this fun bonus life. And with this bonus life, I've been able to really uncover a need in this industry that needs to be tackled. And Rachel and I are joining forces in order to do that with NeuroLivd.
And if you're given the elevator pitch of what NeuroLivd is,
Yep.
Put that out to our audience. They're all looking for that kind of, okay, this is what it does, this is how it functions. What is it in essence?
Yeah. So before I answer the literal question, what I will tell you is this. Over my last 3 years of my journey, the big insight that I've been able to come through is going out into this space with somebody who understands the healthcare industry and has that business background, and then also has 10 years of deep personal passion and understanding of a disease state like mental illness has been something that has been absolutely essential to the businesses that I've been able to consult for over that 3-year time frame. And I've seen lived experience not being utilized to the level that it is. at the level that it should be. And so what we're doing is we're infusing lived experience perspectives into every stage of the mental health, wellness, and neurological product development. That is what we are going to do. Not only are we both experts in the conditions because we've lived them, but we're also business experts, policy experts, research experts, neuroscientists, as you've seen with Rachel. And that brings up our good complementary skill set is the two of us together with the actual lived experience that we have within this space is where we can succeed and where we're going to thrive.
And I'm curious too, and maybe Rachel, because you're taking on the CEO post, you can kind of elaborate on that. It's like, what does that require? Obviously, it's one thing to go in and say, this is our mission, here's how we want to accomplish it. But like on a day-to-day practical basis, like what can you kind of get into the weeds of that a little bit for our audience?
Yeah. So, top level is that we translate lived experience perspectives into strategic guidance across every stage of product development, commercialization, right? All the way from initial concept through market launch, beyond. So, depends on what size of the company we're working with. For startups, you can think of us as something like a lived experience integrated accelerator, right? So, we embed those perspectives into strategy, into business development, fundraising, clinical research, go to market planning. We really ensure that products start from an authentic market fit rather than trying to find it or test it later. Because the lived experience shows us what that traditional market research misses. So we're going to be building relationships and helping to draw connections with people with lived experience if it's not something that we have expertise in on our team, right? We're going to help build teams not only of advisors, but we're going to be bringing in a level of translation. So the ability to take those lived experience insights and translate them into things like um, product design or engineering details, right? It might be how you architect your code. It might be what your security strategies are. And it's going to also include anything from strategic messaging, communication, all of those things get supercharged when we integrate lived experience. So we're going to set up that infrastructure, we're going to define strategies, and we're going to actually build in and facilitate those engagements with people with lived experience so that all of these things that often get missed won't get missed. For more established companies, we're going to build the infrastructure and processes that bridge that gap between boardroom decisions and real world user needs. We're providing tools, training, strategic frameworks that help teams understand not just what their end users do, but why they make the choices that they're making. And that sounds obvious, and I think that a lot of people think that's what we're doing when market research gets done. But it turns out there's really a lot that's missing. So it's that translator function that's really, I think, essential.
One of the core things I was going to say too about lived experience is, lived experience has the power to see what others can't see. And the other thing that I've noticed in this space is that lived experience is an afterthought if it's used at all. There's definitely places where it's used well, but I want to make sure that it's not an afterthought and that it's absolutely something that is essential and vital and core to the development of every single product or technology in this space. Every single industry, it's absolutely, point of entry. And that's somewhere that I feel like in this space, we can do a much better job at. And that's what we want to have happen. And so when I give the example of startup to add to what Rachel was saying, we want to embed ourselves, and we are embedding ourselves within this startup culture where we're an equal seat at the table. We're not just the patient story. We're not a one-off patient market research. We are skilled business folks who are right at the table building and creating from the ground up. Let's make that happen. And then when you get into the more established industry and more established businesses, bring us in, right? When you look at the agency world, you go into agency world and you have core essential business within this space. We're your guys, right? You go in and you do a pitch. There's nobody better to have right next to us than us who can lead, guide, and make it happen. Same thing for established on the pharma and biotech side. We have the ability to come in and see and develop and create different worlds that you've not been able to see from a lived experience standpoint. We can sit right next to you and make that happen.
And I appreciate that too. Again, seeing where you're kind of filling in the gaps, being able to bring your respective expertises to the table. I know that you've obviously, at the time of this conversation, going live on Monday, you've been working with, like you said, a range of companies, whether
Mhm.
startups to more established companies. I know you probably can't identify them for, contractual reasons and stuff, but you talk a little bit just about what that experience has been like thus far, and also the team that you've gathered around you to help in terms of advising and supporting this mission.
Well, I can tell you that of the first three startups that we're working with, they are actually the first three startups that we had conversations with, and across the, and we've got a number of others in the pipeline. And with everybody that we've talked to so far, there's a lot of excitement, and we're hearing, my God, there's nobody doing this, and this is so needed, right? Like the value is just seen right away, and people are really excited to have us on board. Jon.
Yeah, we exactly like Rachel said, we started with 3 conversations, we landed with 3 partnerships, and all of these are based off of one of the current examples that I have is working directly as the director of lived experience for Motif Neurotech. We had created that position in order for me to come in from the ground up and help these guys build a actual lived experience advisory board that I play an integral part of. That started at 3 people, it's now gone up to 7, and we sit with them at the business table and help create this product, co-design it from the ground up, right? We're going to be along for the entire process until this product is commercialized and done. That's the right way to do this from the very beginning. We're trying to get that to be the commonplace solution for every single person in this space. Let's start early. Let's go through to the end. Let us be a part of that ride. If you happen to be more established, bring us in and we're going to help you make it as good as you possibly can be.
Jon, this question was inevitable just because it's our audience and it's how I think of the prism of any story, whether it's in the magazine, on the website, and the podcast, is what does it what does it amount to for medical marketers? How should they be perceiving this news? What does it mean for how they do things? And so I pose that question to you: is when they look at the launch of NeuroLivd, what does that mean for medical marketers?
Yeah, what it means is to sit back and sit back and think, how are you utilizing the patients that you are trying to reach? How are you effectively doing it? What can you do more of? How can you get them to be a seat at the table from the very beginning to the very end of the product development? And the reality I would say is most don't use it as effectively as they can. And so that's what we can do. When you talked about the team earlier, we have a phenomenal group of people behind us. That same thing, not everybody, but a lot have lived experience, are in this space, and are masters at their craft, masters at their trade. That's what's unique. That's what's different. We have the passion, we have the understanding, we have the ability to come in and make a big difference. And back again to the medical marketers that are out there, we have the ability to see those aspects that you can't see. We have the ability to translate them into from a business standpoint because we've lived your life, we understand it, and we can make your products as successful as possible.
Rachel, is there anything you want to add? Again, I know that Jon comes from our world, and so he's able to talk about that from a communications and advertising perspective. But you come in with the science aspect. Is there anything to say the pharma and biotech people that are in our audience that maybe are more familiar with that side of the business? Anything that they should keep in mind with this launch?
Yeah, when you integrate lived experience perspectives on your team from early on, you don't have to do the market research when it's time for marketing. It allows you to form really authentic, more comprehensive relationships with the people in that community. I like to say that it's the difference between having a waiting list for your clinical trial, and having to raise awareness of your solution and why people should want it. When you start from the perspectives of your end users, of the people with lived experience, you don't have to you're gonna catch a lot of things. You're gonna make the imagery, the metaphors, the everything is gonna much more closely match their experience. You'd be surprised at when people think about what it's like to have mental illness, or choose symbolism or other things with that. Somebody with lived experience is going to come in, oftentimes with a really different perspective, and when you can actually match that perspective, your resonance is going to be a lot stronger. But if you form the relationships, your focus is less on raising awareness, and you can focus on things like um, shoring up your brand's relationships with the community.
Mm-hmm.
I'll add one more thing in too, Jack, is just to specifically get to it. Think of the brand team meetings that everybody has, 2 weeks, 4 weeks brand meetings, right? Everybody gets together within the client side or agency side. How many folks are sitting there that are actual patients? How many lived experience people are in those rooms? There's not. And so that's what we are. That's what we can do. That's one of the many things that we can do, right? But the actual end user having a seat at that table doesn't typically happen. And so we have the ability to come in and be that person, form those relationships, be an equal partner at that. We're not the standard one-off market research, right? I know how this world works. You do the one-off market research, right? You do the psychographic research. We have the report. That's not what we are. What we are is getting deep relationships, authentic relationships, a true understanding of the products, a true understanding of the actual community that's out there that's serving them. We know how to talk the talk, walk the walk, and we get it. And so that's what we are, is a true equal partner at the table, making decisions with the collective whole to make your product as successful as possible.
Jon and Rachel, it's been wonderful to have you on the show here to talk about NeuroLivd. And, obviously, Jon, in the course of the conversation that we've had, how much I admire what you've done in terms of mental health advocacy and being able to parlay your own lived experience, but obviously your expertise in the marketing communications field. For those in our audience who may be listening to this and saying, hey, I want to get involved, I want to learn more, how can they get in touch with you? We will put your LinkedIns as part of the show notes, but how can they get in contact with you if they have any questions?
Yep. So the website will be neurolivd.com, neurolivd.com. You can email us at info@neurolivd.com. And we look forward to hearing from you. It's going to be a great ride.
Awesome. Well, again, really appreciate you coming on the show here and trusting us to be able to tell your launch story. And hopefully we can have some follow-up conversations down the line in terms of the impact that you're making in the industry.
Appreciate you having us.
Real excited. Thank you.